Today we'll hear from Dr. Quinn about this condition as we approach Valentine's Day. Good afternoon, Dr. Quinn.
Hey, good afternoon to you.
And Dr. Quinn, have you seen this condition during your practice?
You know, I have, unfortunately. And the first time that I saw it, I was in my residency. It was actually on Valentine's Day. A patient came into the emergency room and she had chest pain and shortness of breath. We did the cardiac enzymes. We did an EKG. They were all pointing toward the diagnosis of heart attack. So we admitted her. We then got what's called a stress test, and there was no blockage. Heart attacks, there's blockage in the coronary arteries on that stress test, but she had no blockage. But then we got a little bit more history. Turns out, earlier that day, she got a phone call from a man that she loved. She was thinking he was going to ask to marry her. But he told her on this Valentine's Day, he had to make a choice because he had two girlfriends. And she was not the choice. She started developing a chest pain, ended up in the emergency room. And with that history, that's when we had our diagnosis of broken heart syndrome, a real medical diagnosis.
Oh my gosh, that's terrible. Two girlfriends, I can't believe it. Well, she's better off dating someone else. What causes this condition and how can doctors determine the diagnosis?
Well, basically, as I said, this is a real medical diagnosis. And what we do is we look at all the diagnostic tests as we do as medical doctors. Now, note that her cardiac enzymes, these are blood tests that indicate that you have a high probability of a heart attack. They were positive. The EKG was positive, but the stress test was negative. There's no blockage. Also, she had an echocardiogram with ballooning of the left ventricle, which is also telltale for broken heart syndrome. But the deal is usually after a very stressful event where you get those stress hormones and it causes you to have this condition. So it's something that you really want to be on alert for.
And how can this be prevented, or if they do have it, what can they do to get better?
Well, the good news is broken heart syndrome usually resolves in a number of weeks where people get, back to normal standard. But for some people, especially people that have pre-existing heart problems, like people that have high blood pressure and not follow up with their doctor and take their medications, or people with chronic congestive heart failure. These are individuals that really need to follow up and make sure that their heart is healthy as possible. Eat healthy, exercise, and do everything you can, and also avoid stress. And like the patient at the beginning of the story, stay away from bad people. And that way you have a better chance of avoiding broken heart syndrome this Valentine's Day.
Thank you so much, Dr. Quinn.